Well, with so many people trying to turn back the clock on aging and the whole process, the options seem endless. Botox is the treatment most used to erase those lines, but it's now getting a run for its money from something called Dysport. Dr. Paul Stanislaw is the first in the area to offer this new alternative, and he joins us now. Welcome.
Thank you very much.
Now, you know, you hear Botox now becoming so popular. It's like people have these Botox parties and everybody gets together. Talk about a little bit about why it's so popular.
Well, Botox is very safe.
Okay.
It lasts about 3 to 6 months, depends on the person. It's used for wrinkles of the forehead, in between the eyebrows, and the crow's feet.
Okay, so now we have Dysport, and what is the difference between this and Botox?
Well, it's the identical protein, active protein. It's injected the same way, so it's in the forehead or the glabella or the crow's feet. It has been used in Europe in 27 countries since 1991 for cosmetic use. And the feeling from that experience is that it lasts a little bit longer, and that its onset is a little bit quicker.
All right, so now people are coming in and there's all these different types of fillers. You know, some last longer, some, you know, don't last as long. So this being the new one, why are we all of a sudden hearing about it now when it's been around in these other countries for so long?
We've been hearing about it in the United States for about 10 years. I mean, there's been talk about it for a long, long time. It finally got FDA approved in June. They were going to try a different name. They're going to do Relaxin, which is a little bit more nice of a name than Dysport. But the FDA controlled what name they could use, and they stuck with Dysport.
So if somebody's coming in and they're looking at Botox, I mean, why would they choose Dysport over Botox?
The onset of action is a little bit quicker. So instead of about 7 to 10 days for Botox, they feel that it's about 3 to 7 days. So it's a little bit shorter. The fact that it lasts a little bit longer, about 1 month longer on average, is a little bit more economically better for some people.
Right. Now, when do people start getting these fillers and you know, Botox treatments and whatnot?
In their early 30s. I mean, it really goes from their 30s to the late 60s. So it's pretty common.
All right. Now, are you seeing a lot of people continuing to do this and then kind of graduating to other types of fillers, or?
Very much so. I mean, even with the economic downturn, Botox, the Dysport injectable fillers have all been very, very popular. They've still been very attractive to people, especially on a budget, because it is less expensive than the surgeries and stuff.
Right, and it is quick. I mean, it's, you know, somebody can go back to work right after. They can. There's not a lot of downtime or anything.
It's one of those lunchtime procedures where you can just go and have it done and be back at lunch, and no one would know anything happened. Are you seeing that as the most popular thing that people are coming in to? Very much so.
Yeah.
In 2006, 3.1 million people had Botox.
Wow. And now you are the only person in the area doing this, the Dysport now, correct?
I'm the first. But I'm sure a lot of people are going to start to
follow suit after you.
Yeah.
All right. And of course, we can find your website, a link to it on our website at fox61.com. Dr. Stanislaw, thank you so much for being here. We're now going to toss things over to Mr. Joe Fury to see